Hi, Nick here, MedTech World 2025 in Malta with Karl Farrugia, the CEO of Malta's primary health scene.
Hi, how
Hi,
are is everything?
it's great to have you. Have a man of your caliber here, looking out at, I guess, so much foreign influence here,
Yes, it
but
is.
also like a strong local contingent from the likes of yourself in the government.
Absolutely. We Maltese like technology, we like changing the culture. So what we're working upon at the moment, I'm in primary healthcare, as you said. So what we're trying to change the culture and the way we were doing things by basically including technology. So technology gives us data, that data we're transforming into results, and with those results we're changing the process by which we assess our patients. So basically we're introducing a new ticketing system. We have introduced a new analysis on how we do the streamlining of the patients, and we're seeing very good results. Results that show a reduction in waiting time, a reduction in infection control, because we are spreading around the patients, and above all, we're working more safely, because now the patient, when he comes into the primary healthcare, he's assessed by a senior GP. We're also investing strongly into AI for diagnostic, like glaucoma and like breast screening, and we will have the first technology coming in the coming months. And by that, we reduce the strain we have on our limited clinical resources. So we want to use AI not to replace, but to assist. So what we're seeing here is a tool that assists our doctors to give them more time to spend with the patients. The human aspect will remain, and we want it to remain because obviously every process of the way we're working with humans, and humans need human intervention, human support. But above all, we're giving more time for patient care. And with that, we're giving much more accurate results because obviously we all know that technology can see things more than a human eye can see. But we're not limiting just to AI. So that will give us the comfort of our own doctors and nurses and allied health to use that data efficiently in giving the right diagnosis. What we are seeing as well is a shift from what we had before. We have a lot of fairness, as you said, that are coming down to Malta. And obviously, it's training our resources within the health system. Primary healthcare is the first port of call, so we have a responsibility of identifying the needs, but more than that is following up the care because we have more than one intervention for each patient that comes. So we do, with a population of 500,000, we do more than 1 million intervention per year. So that says a lot on what we're doing at the moment. And above all, we are trying to become more patient oriented. So we're using the data to help us out in giving a prognosis of what the patient might go through, not just doing the results from what we're seeing and once the patient is hit by a disease or by an event. But even before that, because we're following not just the patient, but even his relatives. Primary health takes care of the father, the children, the wife, the uncle, the whatever. We are seeing that we can even predict certain situations. So with that, we can screen patients and preempt any part of the disease from actually deteriorating or occurring. So we are the first port of call. We're trying to reduce the numbers we're seeing in hospitals because hospital care costs much more than primary health care. And we're trying to increase also workers. So we're enticing we're enticing doctors to come work with us at primary health.
And data, I was speaking with a prior person in the hot seat just an hour ago, talking about how data, it helps on the, even before primary healthcare, we're talking about care in the home. The data can allow certain services to be deployed, information deployed from the home, so not to be taking the resource, right? What you've got to worry about is that there's enough to go around for every person in this country. And I guess utilizing the home carers that exist here as well, making their job, their lives easier to do their job in the home really helps in terms of utilizing our
Absolutely.
resources best.
Absolutely. In fact, we're working tightly with the elderly care and with the homes to give the best service we can without straining our own resources and by utilizing the services they have in the community as well. So it's important that we have a seamless process between primary, secondary, and tertiary care. And we're seeing that we can capture patients much earlier once we have also activities inside the homes, inside the elderly care, with people that require our service. We know that patients most often come to our system when it's late in the day, And once we are now going outside our sphere into elderly and community care, we are capturing much more episodes before they occur than what we used to have before. So all this is helping us in giving a better care, but most importantly as well, putting the resources where we actually need them. Resources are scarce here in Malta and everywhere else, you can imagine. So we're dedicating resources exactly where we need them.
Karl, thank you for being, I guess,
Thank you
part
for
of
the,
the boards for
for the
supporting
invitation
our
and
summit,
for this.
and for going out there and kicking ass and representing primary healthcare in this country. Thank you.
Thank you very much.
So, thanks, Karl.
Thanks.
Nicholas signing off from MedTech World.